might just have to share my YouTube and then we just do it from YouTube. Doesn't look like it's going for YouTube live. Maybe Facebook just got too many people going live or streaming. Facebook just got too many people going live or streaming. What? Facebook just got too many people going live or streaming. What are you watching on? What? Facebook just got too many people going live or streaming. What are you watching on? Well, you have to turn it down so that it doesn't interfere with feedback. Yeah. Well, you have to turn it down. I don't know why it is, but there's a feedback. Do you hear feedback in your headset? Try going out of the room. Because we're live on YouTube, but not on Facebook, it wouldn't go. That's interesting to me. It wouldn't go through on Facebook. But you can hear on Raymond, go out into the hall area and see if there's still feedback. I want to see if you're the source of the feedback or I'm the source of the feedback. But you can hear on Raymond, do you wait, I think what it is. You can't mute it. Now say something.
You talking to me?
Yeah, I can still hear you even if I'm mute. I think I might be the source of the feedback. I have to mute it on YouTube so I can't hear that part. But I want to make sure that they can still hear me on YouTube Live. I have to mute it on YouTube so I can't hear that. I'm trying to eliminate the feedback because we're live on YouTube, but just not Facebook. So I think I'm gonna just share that feed to Facebook. And then you can share it on your page. Let's see, how do I? Well, typically, it's a little different than this. Okay. This is easier though, essentially. I said that's easier though, essentially. For me to have created the separate YouTube and just shared it.
Oh, so go to that Zoom that you just sent?
It goes to this one, they can see us, but I'm on YouTube Lives instead of Facebook Live because Facebook would not. It wouldn't go.
Okay, let me see.
Did you see? I tagged you in it.
Yes. Let me share it to my page now.
So if you guys are coming in, just give us just a second. I'm just sending out a couple of shares, trying to kind of manage both of these things at one time. Okay. Okay, so I think this way I can see, at least I can see the comment thread in the YouTube on here. And I don't think there's a feedback anymore. You would have to join on that end and see, because I wouldn't know otherwise. So you want to test it out and find out?
Okay, so join on which side? On the YouTube on my phone?
Yeah.
Yeah.
If you have a headset, I guess that's easier.
Don't see any feedback coming through.
Okay.
Hey, Mom.
Hey, Michael Lee.
Tomorrow, I'm going to play soccer with this ball for my friends.
Good.
So, race.
Okay, let me know when you're ready.
I'm going to school tomorrow.
Yes. So are you you're about ready?
Yeah, I'm ready.
Okay. Let me see. Yeah, I can only do one live stream at once. Polling. I'm sure I don't know how that works, but let me see. That may not let me put polling questions on the YouTube live. So I better not do it. So let me see. I think mostly I've shared the link on the rest of the platforms. Yeah. Did you share it on your side?
Mm-hmm.
Okay. So Facebook Live is a lot different, I think, than the YouTube Live piece. Let me see. Let me see if I can share this into IWP. I'm gonna share the stream to them.
Quick question. When you go to your page and you say start live video, how do you connect it with your Zoom? Because I think it's allowing me to connect to go live.
Start live video. Oh, on your Facebook is different than on your, yeah, Facebook is gonna be different. It's gonna be a different option than Zoom. So in order for Zoom to stream it live, it would have to be basically coming from the Zoom platform and going over to the Facebook. Does that make sense?
Oh, okay. So it's a way you have to get it to connect the stream over to it.
Mm-hmm. But if you shared the link, your followers should be able to follow it to over here.
Okay, got you. Yeah, I shared the link.
Yeah. Because YouTube Live is pretty much the same. It's just allowing people who have a YouTube account to view you versus just a Facebook account.
Oh, got you.
I'm just trying to find the link really quick because I mentioned that my IWIP members they could get in on the discussion. However, I don't have the link out there yet, so I need to do that. Share. Hmm. Yeah. Okay. I think I'm about ready. Okay. So I'll let you go ahead and introduce yourself because for the most part people know me. And that way they'll know who we're featuring. Oh, and also for those of you who are tuning in from Marcus's platform, I'm Dr. Jefferson, and we're going to discuss a wide array of things, a wide array of topics around COVID-19 and basic survival. We're going to talk about those things today, and we're going to welcome lots of feedback from you guys because, of course, we want to know how you're doing, how you're faring. For those of you who are joining us via the YouTube link, make sure that you're typing your comments because we will be able to kind of see those. And I was trying to find a way to synchronize that with the Facebook interface, and I just couldn't. So lots of people know that I'm not techie, not really, but I do try every once in a while. So what I'll do is I'll probably try to link us a voiceover on the Facebook side, and that way I can have both of those up, and we can welcome comments from both sides. But in the interim, let me go ahead and say to you guys that I do not own rights to the music that you may hear playing in the background, because I know that will be something that will cause the video to be silenced even on YouTube with their consents and restrictions and that kind of stuff. So I'll let you go ahead, Davis.
Hi, everyone. I want to introduce myself. My name is Marcus Davis. I currently am a podcaster at Unplugged Health. Let me tell you a little bit about Unplugged Health. Unplugged Health is basically about being an advocate for your health, not only physically, but mentally. We focus in on the holistic approach. So our thing is to make sure we're passing out credible information to those untouched populations so that they could be able to tune in, and not just the untouched population, anyone who feels like they're, going through a phase in their life where they feel like they want to get a little bit more in touch with their physical health, mental health. We speak on various topics. We get to interview wonderful people like we have tonight, Dr. Jefferson. We get to, speak on different topics and get to pick people's brains and bring the information to the community. We get to bring that unplugged off the clock conversation. So I'd like to welcome myself Unplugged Health. If you guys like to follow me on Instagram or Facebook at Unplugged Health, my name is Marcus Davis again, and I hope you guys enjoy this.
Okay, and so tonight on the top of our discussions, we're going to talk about the overwhelming hit, because we're both in Atlanta. To most people are just now finding out that Georgia will be one of those places where, they will see the phase plan for reopening begin here. And we're talking about here in Atlanta, there are certain things that'll start opening up as a part of that phase structure as far as the reopening. And I want to know how you guys are feeling about that. So I'll let Marcus kind of give us a little bit of his insights as to how he's feeling right now, whether or not there is any, anxiety around that, and what his personal insights and feelings are around opening at this point, even if it's at a phase reopening idea.
Um, Currently, right now, I'm open to the idea of the reopening of the community slowly. I don't think we should immediately reopen everything, but we need to progressively open everything up, which is why I understand they're opening up the community in phases. And I believe that, to restore our economy, we need, outside of our essential workers, we need other people to go back to work, because if, in order for the money to flow within the community, we need to have a community that is operating. A complete shutdown is what I don't think should be happening for so long, but I think as the numbers slowly decline and we see that the infection is being controlled a little bit more, we should continue to, open slowly, not hesitant, and, keep to the guidelines, make sure we're not keeping more than 50 people in the event, making sure that people are washing their hands, making sure that people are wearing the mask. We should continue to use our isolation, you know, material to make sure we're staying protected. But I do believe that we as citizens should do take the active time to get back out there and not be so afraid, because we can't allow the virus to keep us down too long, but we can implement measures to make sure we're staying healthy and safely doing activities to continue to run the economy. I mean, myself, I'm not so hesitant to get back out of there, but I am a little hesitant to be in crowded areas. So I know in order to protect myself, what I can do is kind of maneuver my way through different things. Schedule time periods where I can go to the grocery store. Schedule time periods where I can work out in the gym or get a haircut when it's not so crowded. You have to still be able to be cognizant of the things that the CDC put out there and be able to maneuver your way around those things. It's not so much that we have to stay isolated in our homes forever, not to, contract this virus or, this pandemic or become a statistic of the pandemic, but we can be advocates and get out there and safely protect ourselves and operate in a large community.
So, do you think that people are more afraid of going back to work and what may potentially happen to them as a result of them going back to work, or do you think they're just afraid of the possibility of a more aggressive shutdown happening after?
I would say, in my opinion, it's about half and half. I think, it's about because it's so much in the media these days. It's just so much that people are reading. And, a lot of people tell you, please make sure you're reading credible information, accredited information. Please making sure you're following accredited websites, making sure you're looking into those websites that are presenting information to you and before you present it to other people. And I think what's happened is that people have built their anxiety on a lot of misinformation. So I think people are scared to go back to work because they're like, I'm reading about 5G over here. I'm reading about, that COVID-19 could kill you if you just touch somebody, cough on somebody. We have to make sure we're reading accredited information. And I feel as though, people in the community shouldn't be afraid if they're following the CDC guidelines. I don't think a lot of things will be put out there to harm you, but we're doing it for the best for you. So, like on the other side, for people who want to get back out there and who want to work for their families, they're like, I've read the guidelines. I've read the accredited information. I know that you're less likely to contract COVID-19 if you just potentially wash your hands. Wear face masks when it's needed. So, it's half and half. I think it all depends on the people who are actually being an advocate. And that's where you go back and be an advocate for your health. You don't just follow the trend. You go back and actually do the research, listening to accredited seminars, and listen to your physicians, listen to those people who tell you the guidelines of when and where you should open back up and how to open back up in a safely manner.
So do you think that mostly people, would you say that the vast majority of people think that this is 5G?
A large percentage, I would say, from you viewing Facebook and Instagram, and just several other Zoom calls I've been on, like misinformation. People are just saying, all right, we gotta buy up all the bleach, we gotta buy up all the, go and buy up all the Lysol we have. We have to go buy up all the tissue. So it's just so much that people were misinformed about or didn't know. But I mean, I would assume just as the government and the doctors and the physicians and people within the CDC was learning about COVID-19, they were slowly rolling it out to us. So, there was no expert at the time in my understanding of when it all came out. So I think at that moment when people just started hearing people are dying from a virus, people just started panicking, and then they started, of course, the media started taking advantage of that, posting different things, and it put a large mass variety of people into a hesitant state where they were just like, I don't want to go anywhere. I don't want to do anything. I heard 5G is going to kill my family. Let's just all stay inside.
So what about when they started getting the reliable information? Do you,
Um,
having had the more reliable information, do you think that people ignored that? And do you think they had, I guess, an increased propensity to rely on the things that were unreliable?
um, I would say again half and half, because just like today with just generic information, even just like the flu shot, it's half and half. You have a half of people who believe that it is important to get the flu shot. It's how you take care of your immunizations. It's how you stay, it's make sure how you keep your body at its healthiest. You follow the procedures, the guidelines, you get the shot. And then half believe that no, that shot is the devil. They putting the disease in our body. It's I feel as though, I feel as though that's what half and half it is. It's always going to be that unstructured battle. And I think what we're seeing in this pandemic right now is that unstructured battle. We have half the people who are telling you, we have accredited information, research, and documents to show you that you have to follow these guidelines to stay protected. And then you got half that's like, I don't have to follow that. I already know I don't got any pre-existing conditions. I don't have to wash my hands. I don't have to cover my face with a mask when I gotta go in public. I can have 6 more people at my house. This thing ain't affecting us. This thing is overseas, like they said. You only get that if you bathe with a certain product or you walk into a certain environment. There were people who believed this kind of theories, and it was just like, Where did you hear that theory at?
Well, let's talk about the shade room, how all of that information came to the Black community. And then until we saw the numbers peaking in the Black community, it's almost as if the Black community thought that they were different than human beings, right? Because in the very beginning, we already said that this affects humans. People needed to be weary of being in large crowds and that kind of thing. And so having a source where the vast majority of their following is African American people, listening to them, and then having them go out and put out information that's not reliable and say something like, oh, well, you know what? Melanated people can't get this. Do you think that that's something that definitely contributed to the rise or, that peak in numbers for African American people?
Oh, yes. I think that played a large effect on the spike of coronavirus because I think even when we heard about the tickets going on sale at the first stage of this, it was like, let's hurry up and buy tickets. We go to Miami for $45 round trip. A
Yeah,
lot of people was contributing to that.
yeah, they're
And
like, that's the move. I'm going to the beach. Like, what's wrong
yes.
with y'all? Oh, y'all not traveling? We can't get this.
So,
The sun loves it. We're not the devils under the sun, right? So that I heard a lot of that as well, because like people were saying, oh, well, Black people absolutely cannot get it. Melanated people, if you're Indian, those kinds of things. And even though there is still no tested, true, and tried information out there about boosting your immunity, I want you guys to think for a second while they're developing a potential vaccination, right? So many people are already on the idea, or they already have their own personal feelings about not being vaccinated. But I want you to think about the way the coronavirus functions. It is a mutagen in a way. It's a virus that mutates. If you understand virology, it's a virus that mutates from host body to host body. And so if you don't have a basic immunity to this strand, then maybe the next strand, any you won't have any protection against it. And so you need to be thinking about that as you're thinking about taking an immunization, because the immunization is going to be synthesized with an old virus strand, right? So not what's currently mutating out there that you may be potentially exposing yourself to. And so you still have to be cognizant of what you're doing. You have to be practicing what we consider to be best practices when you're out in society. And that is one of those reasons why it makes more sense for us to go ahead and open up um, government, should I say, oversaw facilities as far as like beaches and, um, libraries and parks and recreations and that kind of stuff, because people need an outlet. And so as we're looking at the phases of reopening, you're going to open up things that provide self-care first. Because I think the part that a lot of people aren't realizing is that I don't know how many of you have watched or into like horror movies or whatever. And if you're not, that's fine. But everybody should go watch Cabin Fever. And so what happens to a person when they're locked up and isolated away from everybody for long periods of time? They develop depression, anxiety, and some of them become a little psychotic. So they start to see things and hear things that may not be there, because literally they're losing all sanity because they're ready to get out. That's why you see so many people protesting. They're like, listen, we've done our part. Let us go out and enjoy our life, live our best life. If anything happens, it's on us, but we've done our part. Our COVID-19 is gone. Let us out. And so I think that a lot of people are ready to get out, but then you have a lot of other people who have grown comfortable with the idea that they can sit home and collect this extra income and not have to do anything.
yes.
Now, there are essential workers who are already working every single day. I'm one of them. We get out, we work every day. There is such a small percentage of essential workers who are, getting sick and dying from COVID-19 at this point, that you need to think like, okay, is it really that unsafe if we go out there and we re-enter the workforce so that we can start trying to stabilize out this economy? Because let's talk about some of the other things that are going to be open, like bars, clubs, and that kind of stuff. So you're not at the point where you need to actually be all 6 feet away from each other anymore, because by now people should be fairly well. But we're going to do this thing slowly, right? So that's what we're saying. Let's see what happens. We're going to put a little bit of people out there at a time, and make sure that they have adapted to the new norm, because right now there is a new norm that we need to adapt to. And what that is saying is that we need to be more cognizant of how we take care and what we do to cleanse ourselves and cleanse our environment and that sort of stuff. And so what are the best practices for that? Using Lysol, using Lysol Clorox wipes, just basic soap and water, washing your hands. A lot of people don't do that, or haven't been.
Yeah, a lot of, I think a lot of people started taking it serious. Like I told you, a lot of people don't. A lot of people, I feel as though, in my own personal opinion, they will not take action towards something until it affects them directly. We always feel like if nothing is affecting us indirectly, we won't take precaution to it. And when we started to see the pandemic and the numbers rising and it started hitting home, especially for the African American culture, they were like, oh, at first, like you said, the Shade Room produced so much media that melanin people can't get it. So we saw a rise in millennials and African Americans traveling. But then when
Yeah.
they started putting out news that there are African Americans who are passing away from COVID-19, that's when it started to directly affect us. And that's when we started to have to look into the numbers and be like, oh my God, like now we have to take precaution. But
Right.
sometimes taking precaution, you took precaution a little late in the game. You started to go shopping after everybody had already hit the stores. You started to try to find N95 masks after companies have sold out. You started to worry about hospital systems, started to worry about ventilators after other prepared hospitals ordered their ventilators and set up units to be prepared for this.
But see, I'm going to read a couple of comments. I know. So David says, hey, William. Hey, Andreas. Jeremy, Eddie, David, Cliff, thank you guys for watching. Gerard, Erica, and Gerard. So, hey, Rose. So David said that he's not getting any shot. He's good on that. He says, I don't think most people believe that all people just looking for an excuse to be out and justify why go. Okay, yeah, I do agree with him. So he's saying basically it's not that there is a lack of a belief that Black people can get it. He's like, they're just looking for an excuse to be out there. And so I agree. But here is the thing. So now this is what I don't understand. Okay. What I do not understand is how it is that America took this stance of, what? You're closing us down. You don't want us out in public. What is this going to do to us? I'm not sheltering in place through whole entire block parties. Okay. And so I want to talk to my people now, because that's us, y'all. Come on now. So accountability. Let's hold ourselves accountable for the things that we do that are not necessarily pragmatic. They don't make sense, but we're doing it just because we want to be defiant in nature. And so now that things are going to open up, those same group of people, us, African-American people, are saying, oh, this dude got to be out of his mind, thinking about sending me back to work when people out here dying that's Black. That doesn't make sense to me. You're contradicting everything that you're saying you're standing for. So help me understand, is he crazy for wanting to keep things closed, shut out? Or is he crazy for wanting to reopen things so that you don't potentially face the next Great Depression? Because that's what would happen. So he said, this thing is real. My kid's mother is a nurse and she contracted it. Right. But let me say this thing. Okay. Jeremy, everybody has had COVID-19. Everybody. Literally everybody, lottie dottie. So you may not have gotten a test because you may never have had any symptoms, but every single person who lives in America that have been out of their house in between, I'm going to be honest, October 2019 and now has had COVID-19. Some people, however, are asymptomatic. Just because you're asymptomatic doesn't mean that you have a natural immunity. It means that you don't have a strain of COVID-19 that is deadly currently. Now, the more people that you're around in close proximity, breathing that same air and energy that they have, let's say that, you're now concocting a whole different version of that virus. And then what happens is you're putting out that mutated version, which is deadly. It gets more and more deadly the more people it passes through, because human people are hosts. And so that's what you're going to end up learning at the end. I'm just going to go ahead and give you guys a heads up. I'm giving you guys heads ups literally on this page since the very beginning of this thing. And everything I say comes to fruition. But understand this, understanding virology is not rocket science, it's basic science. So if you've ever gone to high school, literally, you probably got this in elementary school, and you learned about, the nuclear body, and you learned about cells, and you learned about how viruses and bacteria transfers and, mutates. If you learn about the contraction of diseases, you learn about these things, you just forget. Because these are not things that we keep on our mind if we're not in the field of science. For me, as infectious diseases pathologist, it's kind of what I do, right? I've done that for so long that it'll never leave. Even now actively practicing psychotherapy, that's still there, at the center. And so I think you have to apply your common knowledge, and you still have to listen to your leaders. I think a lot of people just didn't like Trump, personally. And they didn't want to listen because they didn't like him. That's what I think. What about you, Marcus?
I feel that, to divvy off that, I feel the same. I feel like a lot of people, you're only great as your leader, right? I feel in that theory, when we talk about that, your country is only great as your leader, or your organization is only as great as your the boss of the organization. So I think what was presented to us seemed like it was like a little sketchy and all over the place, like they said. When we found out that the government didn't even have a team in place, a pandemic team at first, and that there was, they were fired previously before this administration came into office. So we started to see the news fly out those different topics. And when we started to hear about those topics, we became uncertain. And the last thing you want to do as a strong leader is make your team feel like there's uncertainty in the message that you're bringing forward. So I think a lot of people felt like, why follow this man? Is this another hoax? Is this another thing to make sure we go down?
Because in the very beginning, as it was presented to him, he did not believe that this is something that could possibly be truly happening. And you know what? Let me tell you something. That's normal. For people, when you've lived your entire life and you never faced a global pandemic, and all of a sudden somebody comes to you and says that, if you're the president, sir, we're on the cusp of a global pandemic here. There is an epidemic, there is an outbreak, it happened here. This is where we're seeing the first cases. This is what it looks like under the microscope. And I really think that this is something that is going to be a deadly virus and affect millions of American people. When you say that to him, he's like, past tense, because I've been there. What? That only happens in movies. So, seeing it from afar for him, I think was sort of confirmation. But what did he think? He thought, just like with Ebola, oh, well, you know what? They're going to keep their stuff over there. We're good over here. People travel to and from China, geniuses. We've got trade coming to and from China in insurmountable amounts of numbers. And a port city like New York, that's why they were hit so hard. So when we talk about things like that, you got to understand what the risks are, what it takes to mitigate risk. And I think now, with everything kind of cut off as far as like to and from transfers and shipments for trade, I think that this is an ideal time actually for us to be like, okay, so let's go ahead and make our mark, get back to work, stabilize our economy, do what we can to get things back up and running as American citizens so that we won't be so dependent on other countries. I'm reading some of the comments. Now, Jeremy had a very valid point. He said people just need to humble themselves. They just didn't want to do, they didn't want to be told what to do. And I agree. That's what it is, because what are we? American people are the free people, right? We live in a country where it's about freedom of everything, press, speech, and speech. I'm going to talk about that a little bit more in detail later. But we live in a country where ideally these things are freedoms for us. We can do what we want. We can say what we want because we're free to, we have those basic rights. We're not in jail. You're not telling us when to sleep and when to get up, where to sleep, how long to sleep. These are things that cause what is privilege and entitlement, regardless of what kind of American you are, Black American, white American, Asian American, whoever American. As an American citizen, you do not want to adhere to simple rules being put in place without you having all the facts. Mm-hmm. And so it's crazy how people will now want to move and adhere when Obama is now taking a more active stance and saying, oh, well, people, we need to do what's best for us and best adhere to best practices. And people are now doing it. Don't like Obama, but they'll listen. Obama's like the father of people, right? But when Trump said it, it's like, oh, you got me. Stop. I'm not doing that. You know, what I'm not going to do, I'm not going to listen to you. And I think that we're all paying for that in a tremendous way now. And we've just got to learn to hold ourselves accountable. So instead of looking for somebody to blame, when we see these numbers grow up in an African-American population, we've got to ask ourselves, how many people in our immediate circle, in our family, has decided to defy the shelter-in-place order and take themselves out to a beach, even at the beginning of this, because the beaches were packed. Why do you need someone to tell you that the beach is closed for you to stay away from it? I think self-accountability and self-control is something that we need to be better at practicing, at exercising, and holding one another accountable. So we have to do those things if we want to improve our condition and our chances of revamping as a nation that is reformed and now anew in a different place. So I'm looking at Rose's comment. She says, back in 2009, when H1N1 happened, Obama at the time stated that this country requires a plan, right? Because this is, in case this never happens again, no one listening now, look at this. So I will say this, there was a plan, and that's the plan that was followed at this point. The problem is nobody listened. That's the problem. Now, when Obama was talking back then, people listened. And even now, people still listen to him because, like I said, he's like the father of all people. And I have no idea why he has so much influence for somebody that got so many negative views in the media. But people listen, you know? And if you can get people to listen and lobby behind you, I think that you're doing a great thing. And I'm glad that people are finally listening. But the thing is, now people have an increased anxiety around moving outside of their homes. So this is my challenge to you guys with that same set and energy. If you've been going out of your home to go to the grocery stores, you might as well go back to work, because half of these grocery stores have been putting you at risk with these long lines out the door. You know what I mean? Waiting to go in. Technically, my thing is you've been more at risk when you're trying to stand in those lines waiting to get inside of the store than you will be going back to work, where at least you can practice a safe distancing, regimen, and people are more cognizant of how the disease is spread now. So you can be more aware of what you're doing and more cautious. You know what I'm saying?
Mhm.
So why is it that so many people are refuting the idea and the concept that reopening is something that we need to do? I think because a lot of people aren't taking into consideration those people that are extroverts. Those people that are extroverts, they are used to being out in the public, going to the club, enjoying life with their friends, living their best life. They absolutely can't do this right now, and it's causing them increased anxiety and depression, and some of them are committing suicide, trying to commit suicide. So I think for once we've got to think about other people other than ourselves, if that makes sense. What are your thoughts?
I mean, I agree. Like, I feel as though we need to really open up in phases, and people need to be aware of the information that is presented within these phases. Don't go tune into information that is, again, not accredited. Follow what the CDC guidelines are, follow what the government is telling you to do. Actually pay attention and actually follow the steps. Don't create your own process, because as you can see, we had people with the mask. Everybody was trying to create a type of mask that really wasn't protecting them. You have a fashionable mask, but you're not wearing the correct material to actually protect yourself.
They were cute though. You gotta, I mean, to the masks that everybody's been wearing. And let's talk about the masks and the gloves for just a second. As things start to reopen, I do want to caution you guys from wearing gloves in public as a medical practitioner. So I want you to think about this. A lot of you put these gloves on and it creates a false sense of security. So you're thinking that you're safe. And what happens is, right, Jeremy, he said, or drug overdoses. Personally, I lost a family member very young, and that was very, very difficult for me. And it still is, about a week and a half ago, to a drug overdose. And it's very hard. Grief is hard in this state. Accepting the fact that these are things that are happening is very, very difficult right now. And we're going to talk about what grief looks like now versus before as well. And so, yeah, we're going to talk about cross contamination. You put the gloves on and you feel like you're really, really secure, right? You feel like you're protected. One thing that we have the propensity to do without even thinking about it is grab our cell phone. The cell phone goes off, you're connected and you're plugged in way more than we should be. You've got to do everything you want to do, you got to do with your phone. So, either leave your phone at home and take those gloves off after each contact. So if you visit the grocery store, as soon as you get ready to leave that grocery store, before you touch your groceries, you should go ahead and just take those gloves off. You should have a mobile Lysol can in your car, spray the surfaces of the groceries down to go ahead and kill anything that is still lying there, lingering, before you put the things into your car. And safe practices. Get in the car and be done with it. Use another set of gloves if you're going out to another place, because the problem is you're taking those germs, that whatever germs you've concocted from here, and you're placing them here. You're moving them. So yeah, that is cross contamination. So you need to be mindful that if you're going to wear gloves like you're wearing your hands. You can wash gloves, is what I'm saying. Soap and water. What is the other thing? The masks. The masks actually make you more susceptible. At least you have a factor of the wind blowing by to prevent you from getting COVID-19 if you're out there. You want to wear a mask if you're sick. If you're actively sick, and which means you're carrying a deadly version, a deadly strain of the virus, you want to protect other people from that. And so then you want to be on mask patrol. Okay, I'm sorry for those of you that are in the YouTube Live, I'm going to start reading some of your comments. Can you see it?
No, I actually cannot see the YouTube live comments.
Okay, so Kaylee being in New York says, I'm in here. We can't even depend on the US. Right. Char says, Char is in here. Yolanda Hughes is here. Gabe is saying amen. And so this is Callie Bean. Trump waited too long to take necessary precautions. Okay, so I agree. Maybe he advised, I will say this. He advised in the very beginning, okay? People just didn't comply. I don't think he was as aggressive as he should have been in the very beginning, because even for him, there was a little bit of doubt. And even when you have doubt, I think in times like this, you have to be cautious. He says, we also need multiple streams of income that aren't dependent on a single employer. I agree, and we're going to talk about that more in depth. She said, we need to start growing our own food. Let the extra... I am so done with this comment. Who's Callie Bean, New York says, let the extroverts go first. She's an introvert. Let them open up first. But see, this is technically, I want you to think about it. You have a point. And so we've already thought about that. So think about the things, the establishments that are opening up first. They are extrovert establishments. Her comment has me dying laughing. But yeah, and so she was saying, yes, she was talking about she's a nurse and she knows how to wear the gloves and dispose of the gloves properly. I agree, but you should also be helping them, other people around you, properly glove up. You know what? No, because some people get offended, Callie Bean, okay? Some of them like, don't tell me what to do. She says,
yes,
that's right, right. So she understands the best practices. So Yolanda says, I live in Florida and I know that testing is an issue and there's not enough people being tested, not enough tests available. Okay, so let's talk about the why behind that, because I do want to emphasize, while testing is essential in understanding where the virus is, it's very clear to every single person that everybody has been exposed to COVID-19, which is why you don't see a huge rush to test people. And testing is being done on all corpses anyway, but you want to really rely on testing, which is why we're trying to move to rapid test kits. We want to rely on testing at the reopening because we already know everybody had it. Does that make sense? And so we want to make sure that when things reopen, that we're not reinfecting people and people aren't getting it again. Which is why before people weren't being retested as well. Sorry to hear that, Yolanda. No, Callie Bean, she says her uncle is on hospice right now because of COVID-19. But Yolanda, I want you to think about something. Yes, a lot of the elderly population have been testing positive because they've already had it. I told you how long. We got to go back to October. How many nurses and family members that were younger have visited that nursing home? And that, it's disheartening because, it's just one of those things where you think like, well, how is it that we expose our most vulnerable population? But we saw the same thing happen in Spain. In Italy, the numbers were ridiculous. The deaths happened really fast. And that was because it was the older population. Rose said it is unusual opening those types of businesses first. And Rose, that's the reason those types of businesses are opening first, because we want to make sure that people are attending to their self-care, because that is paramount right now. I don't think people understand the nature of what type of crisis that we have right now, basically at the front door. The mental health crisis, number of suicides and depression and that kind of stuff, those things are what we have at stake right now. And it's important that we do something to try and get in front of that. So how do we do that? If we open up things that increase the propensity for people to be able to provide their adequate self-care, then people will feel better. They'll feel more normal. They'll have less stress, and their dopamine and serotonin levels will increase. They'll start exercising because gyms are going to open up. So your oxytocin is going to increase. You're going to have all of these feel-good chemicals allowing you to be more sociable, but now you're more cognizant and aware as well. So how do you feel about government allowing tattoo parlors to open Friday? That's what we're talking about, because tattoo parlors are a part of that self-care piece. How do a lot of people yeah, a lot of people do process their trauma through getting tattoos, okay? I will say, as a PTSD survivor, we see pain as weakness leaving the body, okay? And you want to make sure that you're doing, first of all, tattoo artists who are careful, typically people visit the same people they know to be good at doing what they do. And HIV is a virus, right? So it's essential that tattoo artists are getting rid of used material and sanitizing everything. They're probably one of the cleanest practitioners you can go to right now. They're probably one of the cleanest establishments you can go to right now. That's how I feel. It says, if we don't have enough tests now, so do we have tests now? Are you asking, do we? We do have more tests. There are lots more tests, and there are more coming as well, because we want to be able to gauge where the infection is coming from. Does that make sense? What's causing the infection? If people are more cognizant now and more careful, because they are more cognizant, then if the numbers increase or they continue to rise, then it tells us that people weren't socially isolating, or it tells us that people were carrying a mutated version of the virus for longer than we consider the incubation period to be, so over 14 days. So you say, yes, they open up more test sites today. True. And so Rose is like, pain is healing for some. Hey, Arkino. I agree. Hey, Tori. Okay. First, wait and check out what happens. I'm just reading comments. So our next one is dealing with drama in restricted spaces. Because some people are still going to have to deal with the drama. Some people are still going to be in isolation. A lot of jobs are not reopening right now. And you've got limited spaces to go to anyway. Not everybody is drinking. I don't know. Maybe everybody will be drinking. Maybe that's the new norm. But not everybody drinks. Oh, thank you. I'm glad you're enjoying the music. But our next topic is dealing with the drama in restricted spaces. So some people, since they will be still dealing with having to be in confinement basically, and some people that will be told and advised to quarantine again, those people will have to go back into their 14-day quarantine spaces. And sometimes they will be forced into spaces where they have to be with their family members, spouses, side chicks, or what have you. And that might be uncomfortable for them. And there may be gripes or something that they have to discuss during that time. So Marcus and I, we were talking about some of the things that they could do to kind of make the best out of the situation. If you gotta be there now, of course, all you gotta do is tell yourself, listen, I only got like 3 more days. Do the countdown method. If you're in one of the states that has basically almost next to no cases and they're reopening, you're like, man, I'm hitting that door and I'm running. Okay. But you've got to be, the cases of domestic violence has definitely increased over the last couple of months. And so what we want to do is we want to be smart and pragmatic about what conversations we bring up in these spaces. And so what that looks like is you don't want to be bringing up the time when he cheated on you and how you were feeling and decide that this is the thing that you want to discuss during COVID-19 quarantine. That's just not smart. Because we know that that's going to be a situation that escalates. Now, if you say, hey, I want to create a safe space for us to talk about this, and this is a period of amnesty, because creating a safe space is one of my keys to effective conflict communication. And you say, hey, I'm not going to react or anything. I just want to talk about where you were on the night of January 2009 at 7 p.m. because I got the hotel receipts. But if you wanted to talk about that and you wanted to give him amnesty to admit, or her amnesty to admit that they've done whatever, that's one thing. But you have to keep your word and not do all of the extra things when you're reacting, because you got to be in a place to receive what it is that they have to say. Also, avoidance isn't the answer, because it's going to cause further issues. You have to be able to say to the other person, okay, listen, this is our safe word. Pineapples. So when things get very difficult for us, when I know that we're going to take it to the other level, when I feel like I'm about to be disrespectful or I feel highly disrespected, let's agree on pineapples as our safe word to vacate this communication immediately and come back to it later. And we can say pineapples as we're screaming at each other. We've already agreed before this happened to immediately de-escalate and then come back to this later. So after we say pineapples and shut it down, only thing that needs to be said next, what time we're coming back to this. Let's revisit this tomorrow at 5 p.m. By then, you should have gotten your cool off and we should be in a safer space to have this conversation without you being all down my throat, or respect one another's opinions and perspectives, even though we don't have to agree with them, in a way that allows us to listen to understand instead of just simply listen to respond to one another. Yolanda said, because I'm a fireball. Right. Thanks, Callie. It's good to create a safe space though, but also when you get back to the conversation, you have to have what I call circular communication, where the communication is reflective. And so one of you have to agree to be the first speaker, and that means the other person is the first listener. And as the speaker, you are the one delivering the message. And so what that looks like is, hey, Terry, I found these receipts for January 26th and from Hotel Marriott. I want to know if these receipts are your receipts, because it's kind of looking that way. I figured it was you because it had your last four of your credit card number. And I just wanted to know what was going on at that hotel, during that time. And this is a safe place because I'm not going to respond or react in a negative way. I just simply want to know what's going on. And so then, as the listener, Terry should be the person to say, okay, what I hear you saying is you found a receipt and you already know you already know where I was and what was going on. So did I get that right? And so no, that he didn't get it right. So you're going to give him clarification, right? Not confirmation. And say, no, that's not what I said. What I said is that I know that the receipt has your last four of your credit card number. And I'm curious about what you were doing at that hotel. If you were at that hotel indeed and didn't just book it for somebody, who knows? I need to know the details around this receipt. And so when he comes back to you and say, okay, so you're curious about what happened in regard to that receipt, having my credit card details and having known that I paid for it, the hotel room, you're looking for the details of what happened on that night. And so then you can give him confirmation and say, yes. So then the roles shift. He's now the speaker and you're now the listener, and you're not listening to respond or jump down his throat. You're listening to understand. So that means if he does come through and say, I was with Yolanda and we were having sex at the hotel. I didn't want to bring her to the house. Might have to have a come to Jesus moment inside, but in that space, you need to understand how long has this been happening with Yolanda, or why? Like, what's going on? Like, what's going on with us to the point that you feel like you need something extra? That could actually evoke more of a positive conversation, believe it or not, than not. Right. So this is like it's a gestalt form of communicating, a little bit tweaked though, because my approach I have 3 keys to successful conflict communication, and couples, not only couples, but other people benefit from it too, just lay people, co-workers, because a lot of people in the workplace need this, because sometimes you work with people that will make you want to reach out and touch them in a way that's not appropriate for work, right? And so we have to be honest. I believe in personal ownership. You got to own your stuff, personal accountability. And so if they make you feel that way, you should be able to say, Claire, I'm feeling a lot of things right now.
Mm-hmm.
And I need a break from us. I know you're trying to tell me something related to work, but right now I can't do it. And so come back to it, later, and say, hey, I was just having a moment, but what did you need to tell me? So that's one of the reasons that this method is so effective with people with conflict, because it gives them the respect that they're due, and at the same time allows you to reclaim your time, your space, your energy in your life, and recalibrate where your center is. So what do you think? I know that you mentioned some techniques, Marcus. So if you want to speak to it.
Oh, yes. I want to piggyback off a few things that you mentioned. Like, I think it's highly important right now during this time to be cognitive and be aware of what we talk about in those closed, confined spaces. Because, like, during that time, you could feel like, I may be ready for something, but your spouse, your friend, or whoever you're sharing your quarantine space with may not be ready. You don't want to approach a situation where you're not qualified to de-escalate the situation or kind of help the situation go away. Sometimes I don't say avoid those things, but some certain time periods you can avoid it for for the bigger picture, for the bigger comfort of the space that you're in. Like, this might not be the time to talk about those things in your marriage that the counselor brought up 2 weeks ago that might ignite a fight. This might not be the time to talk about some things that bring up or spark something hurtful in your past that may allow you to become very depressed. Even though we have access to a lot of therapy sessions and therapy, given in the community right now, it's easy to tell someone to seek therapy, but they may not be ready to seek therapy. I feel as though it is a learned behavior to be able to have effective communication. And then some people might not be at that level to have effective communication at that time. So while you're in those confined spaces, I feel as though, transparency is key. Read the person you're with, read their body language, read the words they're saying, read into the key words, and also take a moment to pause and clarify. I feel like sometimes when we're having conversation with each other and we're conversing, sometimes you're not being an active listener. You're not able to clarify or be able to take in what the other person is saying or identify with what they're saying, is because you're not actively listening. So I think sometimes as active listeners, we learn more from the conversation. We're able to take away more from the conversation when we actively sit and listen. And I think another thing we need to do is kind of, before we throw out a negative, make sure we throw out a positive, I like to say. Before I like to put blame on you, I need to shift and say, hey, what can I do better to make this a better situation? What can you do better to make this? What can we do together to make it through this? I think it's a shift about teamwork. And I think, during this time, we're learning that as Americans together, we're learning how to actively listen to what's going on. We're learning how to take note on what we've been doing, take responsibility, hold accountability for ourselves and our actions of what we're doing out in the community. And we're learning how to be a team and navigate this thing, because as a team, we're learning how to social distance. As a team, we're learning how to communicate through this COVID-19. As a team, we're learning how to restructure our environments. As a team, we're learning how to, test and understand what works and what doesn't work. If we don't never reopen the economy, we won't know what worked, because we can't be afraid for too long. So we sometimes it's trial and error. So we have to be open to that new process and the new procedures that are put in place. And like I said, as we navigate these times, as we navigate conversations in our home, we have to take in those tips, because like you said, domestic abuse is getting out there. People are feeling isolated. People anxiety is going up. People are reliving trauma every day when they have to get that text message or that phone call, hey, your loved one has passed away, or hey, your loved one is in the ICU. You have to pull together. These are the times where communication has to be as strong, as because that's how we're actually working through this thing. Telehealth is at the biggest it's ever seen a rise in the economy. We have to understand that communication is key. And in order for us to get through this thing together, we have to actively work together.
And so Ian, you made a really, really good point. He says, because a negative times a negative is positive, and negative behavior corrected with negative reinforcement promotes positive outcomes. And it can. And see, and that's something that we know from years and years, decades of research. When we talk about cognitive behavioral therapy, trauma-focused cognitive behavioral therapy, and behavior reward system, when we know about things and we know about what will happen, and we're not curious about it because we know what's going to happen as a result of us doing it, oftentimes we reshape our behaviors. And the thing is, I think that people like the police officers and we as individuals have to be a better citizen and police our own communities, because I think that sometimes it's our fault. We don't want to say it. But sometimes I think it's our fault because we're not policing our community properly. I don't know why the screen shows up like this. I wanted to share the screen with Marcus so he could see the comments, but it's like YouTube screen times YouTube screen or something. So I'll read you the comments off of the YouTube part. But so, because I am live on both YouTube and Facebook now, Facebook wouldn't let me stream the live to it. So we're doing that, and I'm doing the Facebook side on this side. But I think that, you know, Marcus does have a really, really good point, because the thing is, sometimes we're just not doing our parts, you know, and sometimes we're not paying attention to the things that we do that cause these type of ripple effects. And so we have to work together to mitigate the fear and promote stability and safe practices for us to reopen and do the best thing that we can to at least create some new type of a norm, you know. And I think what that will look like is people just simply being more cognizant of cleaning practices, being more aware of the importance of them safely being at a distance away from strangers. Because when we say social distance, that's really what we mean. We want you to be distant away from the people that you don't know, because you know the Rona that's in your house, okay? You know your family members. You guys have been around each other, had to be around each other this entire time. And so what happens is you're more safe around them than you are in public. But you need to be, safe when you're in public spaces, so that you do the best things to protect yourself and protect your family at home from, you know, being exposed to more deadly versions of, or deadly strains of this virus. I think it was interesting that somebody earlier said I'm good, I'm not getting the immunization. Because although Kizzy is hard at work developing the immunization, it's about like the flu shot, okay? Why would I want a version or a strain of this virus in my body with antibodies for that strain when I've already had the flu before in my life? So the same level of protection, if you will, that I'm getting from this virus now, I already have it in my bloodstream. You understand what I'm saying? But I feel like for added security, a lot of people are looking for an immunization. They're looking for testing because they want to know what their statuses are. You got more people worried about their status for coronavirus than they are about HIV. I'm curious how many people have gotten tested for sexually transmitted infections, but COVID-19, they will get tested for that. And that's good. Don't get me wrong. Any virus is a virus, right? But I think that we have to be more cognizant of how important we value our health, all of our health, because the part that a lot of people have not really paid attention to is the importance of their mental and behavioral and emotional health, because that's what all of this is affecting. So as people, now we're in a place to where you see more people that are very aggressive online. You know, they're cursing each other out left and right. People are less connected to their family members. People are more connected with the screen of the shade room where you have unreliable information coming out every couple of moments. And they're more connected with the idea of 5G and other theories out here. The theory that this is a virus created to kill Black people, all these crazy things, instead of taking a more curious stance and saying, hey, I wonder why it's more African Americans dying from this, or more African people dying from this, or more Asian people or white people or whatever at any given time. So it's about the test coming back at a reasonable speed, you know, so you're getting delayed information, I think, for one. But you have to be cognizant that viruses don't know anything about your race or your gender. You know, they're viruses. They just know that you're human and you're a host and you can carry them around, and that's what they need you for. It's really that simple. Let's talk about the proposed further relief package. Marcus, do you want to take it?
Oh yes, I can talk about the proposal for the relief package. I feel like a lot of people was very accepting of the $1,200. I at a lot of people might argue that $1,200 was a little that barely covered people rent, but I don't think they understood what the $1,200 was actually meant for. The $1,200 was actually meant to be put up for the immediate things like cleaning products or food or things that you need in the immediate action of this COVID-19. A lot of people looked at it as immediate relief to like, oh, I can pay my car note up now, or I can pay my rent up, or I could pay my bills up or the credit card bill off that I've been having. But people didn't understand like all of that stuff is put on hold. People didn't look at, again, accredited information. A lot of people ran out there, started buying plane tickets, ran out there, started booking hotels, or like we said, going to your local dealer. We do have an opioid and drug abuse crisis here in America. A lot of people took that money and spent it on unnecessary things. And, they weren't reading up that actually your rent was postponed. Health insurance companies were giving relief. Automobile agencies were making sure that your insurance was covered for an extra amount of time. Rent in Atlanta, even with the 60-day notice that you couldn't be put out of your home, people didn't realize that reading is fundamental. Understanding what your government is giving and the resources should be used for was necessary to understand where to spend your stimulus check. And even before they started saying, oh, even if you did not file your last taxes, you still receive a stimulus check. A lot of people was running to file their taxes and paying that money to their tax people and didn't know you did not have to spend the money to get your taxes done in this moment, because the relief is for everyone in America. Even people, there are resources for people who don't even have a social security number who are here in America right now to receive a stimulus check. People are not aware of the resources because they didn't take the time to read into what the resources were and what the resources could be used for. I think the $1,200 is absolutely needed. It's helping a lot of people who are using it correctly. Because, I see a lot of challenges and different things out here on Instagram where people are donating $1,000 or people are giving up their most prized possessions to make sure that money can be fueled back down into the economy. But I think, as we continue to see this progress, like that $1,200 just wasn't a band-aid to put over the situation, but it was just a slight alcohol to the situation, a little bit of relief. It's not going to cover up the situation, but it is going to give it a little bit of relief where you feel like I can feed my family for the next 6 weeks. I can, have my necessities in the house if I need something, or if I need to actually, if an emergency travel to someone else's home to quarantine, I do have money to fill up my vehicle to do so. That money was supposed to be used for emergency situations.
Now, I will say this about the previous stimulus relief package. Okay, so a lot of us didn't get any relief because you were over the income restriction, right? And so it phased out somewhere around 125,000 for an individual and about 150,000 for a couple. So this next packet is meant to address those people who didn't previously qualify and those people who did, but now up to 150,000. But and then it'll phase out, slightly close to the 200,000. I will say this, as a person who believes that you should definitely use all the resources that are given to you. There are a lot of things that were given in that stimulus package that a lot of people missed. So they missed the like you said, the coverage for their housing, so mortgage. They just didn't know what they should have been doing. I think that maybe we should have been more clear about what this package is supposed to be covering and what are the constraints for the banks to issue grace, because they're being issued funds so they can issue grace to the people that are owing in their mortgages and their rent payments. A lot of people didn't know that, okay, this isn't something that you'll have to pay back, because all of these fake news opportunities were being tossed around saying, oh no, because you got to pay that money back. It's just simple. It's just ignorance or failure to research and get the information. And I feel like sometimes we've got to do a better job at helping one another hand out more reliable information, and then also at helping to gauge people who need the information that don't have access to social media, because a lot of people simply don't, they're not plugged in. They don't watch the news, they don't have social media, they don't have any of that. And I think that we should do a better job, not only at policing our community, but also in providing the resources that are necessary for people to know where they need to go and what they need to do. So I'm going to read this comment from Carlos. He says, this is the time to reset, not only for people, he said, not only for people, but for the planet. I agree. Because so many people were completely taken aback by the fact that everything was shut down, and they were, all you can hear is negativity. All I could think of is, oh my God, the air has never been so clean.
Yes.
I'm telling you, like, you know, as an essential worker, there were some days that I did not see my family, you know, because when you're working with COVID-19 patients and you know that the infection is high and people are dying, you know, and things like that, you don't want to take that back to your family. And though there were weeks, it was what, a week or so, a lot of medical staff stayed over at the hospitals and things like that, so we could make sure that our families were safe. And I think that sometimes you have to make those sacrifices. But for somebody that is retired military, it wasn't new to me, but it was odd because I'm like, listen, I don't want to be out here civilian now, you know, but you're doing what it takes to help people because the need is there. And my heart is in humanity. And so you've got to do what it takes to help people. You understand? And you got to do that with passion as your purpose. And for me, that's all it was about, you know, and my kids, my household has remained, you know, unscathed. Everybody's good. Nobody's sick, you know, and it's worth making that sacrifice because you're doing the things that you know are best practices. And so I have to tell people, you know, sometimes you got to do things that you know, it's common sense, you know, are right for you and your family. Now, the one thing I didn't like about the stimulus packet is that there were fathers and mothers who are non-custodial parents that may have been behind on their child support because let's talk about it. Some people are on child support, okay, and I am all for kids being taken care of, but some people are on child support and the parents simply cannot afford to pay it. You understand? Like they're barely making a living for themselves, and it's difficult for them to pay it, and it's easy for them to fall behind. And oftentimes, like I said, sometimes we don't read, and sometimes they don't have the resources that they need, so they don't know how to prevent those charges from going in the deficit, right, as to what they owe. And I think it was unfair to take the benefits that were meant to give those people relief and apply it to their child support balances and not give them any relief, because they're still out here and they still need help. They still need money. And apparently they're in a vulnerable population of people who cannot afford to provide for themselves right now. And so my heart literally goes out to those people, because it's like, yes, your kids do need to be taken care of, but also in a time where you're already getting $1,200, moms, dads that are custodial parents, have a little bit of grace of your own and say, hey, you know, I received your stimulus check and let me bless you because I know that you're out there by yourself. Either come stay with us or let me send you $500 of this money to try and do for you individually, because you've got to have a heart for those people. Somebody had a heart for you. You understand? And that's the piece where I feel like there are thousands of people, because there are thousands of non-custodial parents on child support that didn't receive any relief at all. And they're not in an income bracket where they don't qualify like myself, but they're in an income bracket where they do qualify. And they should have gotten something to help them because they need it. You understand? And a food bank just is not going to be enough to do it because they still need cleaning supplies. They're not giving that away at the food bank, you know? So, you know, it's a lot of things that I feel like are not right, you know, about that first stimulus package. And the next one is seeking to give each qualifying American person, so not just the ones who file taxes or whatever, but each one $2,000 monthly until we've you know completely revamped this whole thing. And then you know, the additional $500 per child. But a lot of people are saying, okay, that's not enough. That's for a person with just one child, that's 25. Let's talk about people with a lot of kids now. They're going to get a lot of money. First of all, we're saying to qualify, it's not 112 or it's not starting at 75,000. We're talking about 150,000 or less to just to qualify. And we're talking about potentially you getting this money to help you monthly, and you may already be working because you have one of these non-essential jobs that have already opened up. And a lot of people are like, no, don't do that. Just suspend my mortgage or my rent for the rest of the year. No, that's enough money for you to pay your, you know, I think that you have to think pragmatically when you're thinking about these things. This is more money than you've had given to you. You're not having to go out and qualify and apply for it like welfare or something and wait on an approval letter and all of that. You got to be pragmatic and thinking about this. You know what I'm saying? And you got to make it make sense for me if you're saying that that's not enough and you need another relief, another form of relief, because some of these people might be getting what, $5,000? Some of you don't make that. You understand what I'm saying? So this is money in addition to whatever income you're earning. And it's just a lot to that piece that is just, it's crazy to me. But I do think that for the people that are back on their child support, it's going to clear out their debts. Say that. You said, well, what happened to the people stimulus going to their prepare? Oh my God, Yolanda, let me tell you, when I saw that was happening, when people's taxes were going to their tax accountant, I said, oh my, wow. I don't think, I don't know. I don't think that that's fair. It's right. It's just. And even worse than that, Yolanda, let me tell you something. Some of these banks receive the funds for people's money, and some of them rejected the money because these people were behind on their accounts. They forced closed accounts and they refused to take the money. And now that I feel like is unfair too. Yolanda says, I think people have to get their priorities in order. I feel like their priorities may be in order, because you know what? There's some people on child support, their priorities are in the right place, but they simply don't have the resources to know the proper steps to get their child support reduced. Or they feel like, let me go out here and try to apply for this job, that one. And when I get it, I'm going to catch up, and they never do. You know, child support is different in every state. Ian says, I think the educational system isn't doing everything to make these children successful. That's a whole mess. Time to invest in assess. Yes, Ian, listen. I need to get you on this live with us. You said they haven't approved you yet. That is crazy. So I don't know if it's been discussed, but how do you feel about the recent news of businesses opening with certain cities? Yeah, we've already talked about that. We talked about the need, and we talked about, you know, things being not necessarily ideal, but it being necessary, because we have to get things open if we want to not face the next Great Depression. So you guys are all amazing people, okay? All of us are literally a part of history right now. And if you are not taking advantage of that, oh my God. Let me urge you to go back and how you take advantage of that right now in this moment. And if you want to take advantage and you just want to send me your content so I can get it published for you and you don't pay anything, I'll do that. My email is doclqj@familiarbonds.org. But let's talk about this. If you are documenting your day-by-day assessment of this situation, you are literally going to be a part of history books, textbooks for kids in generations to come, because this is a part of history. And you should be compensated for keeping track of what you're going through. Keita says, informative live. So many people need to be watching. I agree. Like and share the video if you guys are on, whether you're on YouTube Live or on Facebook Live, go ahead and share this content, because we still have another 1, 2, 3, 4 topics. We're getting there. But so I think that, you know, you should be sharing your experiences with the people who will come up after you, because we are definitely a part of history. There are a lot of things that are happening that have never been happened before. And we're not talking about Trump's statement about people dying that have never died before. We're not doing that. But he was right. Those people have never died before, really, because they were alive. But seriously, you should be bookmarking everything that you're going through right now, whether it's stress, whether you've had a change in or a shift in perspective. If you've been one of those people that have been in line at a Sam's Club or a Walmart. First of all, let's talk about Sam's Club. I pay $100 a year for Sam's Club membership. I'm going to need to not be in a long line to get inside of it. I'm not waiting in a line, and I'm paying you $100 a year. Amazon Prime shipping. Why are you still charging me for Prime shipping if I have to wait for prioritized shipping? I can't get 2-day shipping. You know, things like that. For me, these are things that I'm shocked that we're still being charged for. And nobody's giving us relief from Amazon, but Amazon got a fat check. So nobody's talking about that. You know what I mean? I'm talking about how we see relief for small businesses have been put out there, and Ruth Chris goes and takes 20. Why would you take that much money? And you know that you have millions of small businesses that need these loans, and the money is limited. Why would you do that? You could have applied for 2 loans, one in the, you know, the front and one in the rear, so that you could cover what you need after everybody else got their money. Mm-hmm. It's a lot of greed that's going on. We need to be documenting it. But the most important thing is self-care. And so in reopening the things in the way that they're reopening, we're allowing people to maximize self-care, prioritize health, wellness emotionally and mentally, and get back to their families. When Ian said the school systems are doing an injustice to the kids, I agree heavily with that. But I think that even more so, we have to take accountability. And as parents, we're doing an injustice to these kids too. Because there are some parents that are refusing to teach their kids. I feel like, yes, it's great to have a school, but if your kids are home with you during this time and you're not putting in that filial time with your child and teaching them, guiding them, shaping them, you are the injustice, because you should be their primary mode of information. You just should. You got to teach yourself to teach them, especially if you're going to do the math, because they do math differently. So go back to the old school way of teaching math equations. You come up with the same answer. Trust me. I'm not doing this, drawing a whole box to solve a simple equation. Like, why? These young teachers, you guys are something. But I'm not doing all of that. So, Bridge Toast are billing you tickets, but not. What? He said bridge tolls are billing you tickets but not taking the general tolls. I didn't even know that.
Hmm, I didn't either.
That's a new one, Ian. I was unaware. Um, so Marcus, I'm gonna let you take the next one, which is intimate partner new connections. And I did
Oh,
talk about it a little bit the other day, but I'm gonna let you talk about that one. Making new connections with your intimate partner.
Within your current relationship, I'm gonna talk about it from two aspects: within your current relationships and a way to meet new connections during this time period. I'll start with meeting new connections, then we'll go over to the people who are in a relationship. I think right now is the best time if people may be a little camera shy or voice shy or whatever, but this is the best time to take advantage of the networking system and the technology that we have out there, especially because it's an excessive amount of time people are out here, they're at home, and they're willing to share what they're going through or who they are, I think. So I think this is the best time to connect with new people or reconnect with someone that you wanted to connect with to get to know each other on a deeper basis. I think this is a time to re-explore if you are single, to go out here on these dating networks. It's a lot of dating apps. I think yesterday I seen someone post on in Atlanta like a Zoom dating app, a quick date. Like you could get into the group and you could connect with people and you could Zoom date like a quick 10-minute conversation, see if the connection is there. Huh?
So speed dating via Zoom. I didn't. Why did I think about that? I'm joking.
Yeah, so you could Zoom, you could be a Zoom speed date, you could get on like, of course, everybody's going live on Instagram where you could connect with people and they could pop you out in the room like smash or pass kind of type thing, where you could connect with people. This is the time to, update those Facebook profiles, update those Instagrams, update those LinkedIn, use whatever network or relationship you would like to build. Use that time to build that. But when we speak about for the couples who are in a relationship, if you're not, you are in a tough spot in your relationship, I think this is a time to reassess your relationship. Like, this is the time where you can not ignite those old, rough, tough feelings that you might have been experiencing in your marriages or in your relationship, but kind of navigate around what can we do to come out this in a better relationship? How could we build on our communication skills? We have nothing but time to be in a room to discuss, or you kind of finally got time to, have that intimacy in your relationship. Because if it used to be you got to go to work, I got to go to work, and we're always on a busy schedule, when do we have time? Or we have to get the kids, or we have other things that take up our time. This is the time to set that table or the schedule to say, hey, we got all the free time in the world to have intimacy. Set a date night up. I've been seeing online where couples are actually saying, we don't have to go to a restaurant to be intimate. You can set up the dining table within your home, cook a nice meal, put on some champagne, send the kids to bed early, or, allow you guys to have that reconnecting time, allow you guys to remind each other we are going through a tough time and people are losing their lives. Remind each other that we do have love for each other. We came together because of some kind of bond. Let's see how we can re-explore that bond. Even if you re-explore it and you realize that, hey, we are better friends, or hey, we can get married now, or hey, maybe it's time for us to see what we can do to navigate to make sure we both live a stress-free life, or a less stressful life, because it's two sides to it. You could come out of this thing, but I believe like during this COVID-19, this is the best time to take advantage of that. Like, whether you're single, self-development is key. Self-reflection is key. Sometimes you're not able to love somebody unless you love yourself. So if you're not taking the time out to explore yourself within, kind of reorganize your goals, reorganize what the things you want to do in life, reset your time clock. We say, hey, maybe I'll be ready to date in the next 3 to 6 months, or maybe, it doesn't hurt. Sometimes you can spark new interests by looking up different interests, and developing things within yourself. You meet people when I know myself, you meet people when you don't even expect it. So I think this is the perfect time to take advantage of technology. Look into those different things to, speed date or chat it up with a couple people. We have the free time to do it. So now why not take advantage of it? But also there's so many apps out there for couples who are experiencing things in their relationship. I know there's an app called Get to Know Your Spouse, and each one of you take a quiz, and you guys fill out your answers, and your spouse has to fill out the quiz, and it grades them on what they scored on the quiz. So that's a great way to get to know your spouse, or to get to know your spouse, because as the years go by, you don't remain the same. I'm sure you're not going to remain the same couple you as you were in the first year of your marriage 6 years later. You hit those rocky periods, those transitional periods, especially when you add kids into the mix, school into the mix, new businesses into the mix. Things change.
Mhm.
Sometimes we're no longer the same. We don't keep the same mentality as we did when we got together. We might not feel the same way about something we talked about when we first started dating. And I think this is an important time to revisit those conversations, or revisit those scenarios, to either make yourself stronger or make you stronger together. Like I said, it's the best time to do it. Why not? I mean, when are we ever, we don't know, foresee in the future, when are we ever going to get this time to spend with our spouses or loved ones like this, and get kind of a little bit of a stipend while doing it?
I agree. And I think that, sometimes we don't give ourselves credit for the amount of transparency in which that we really have for our partner and for ourselves, and the openness. I think that dating with apps makes dating more safe, whether we're talking about COVID-19 or not. When we talk about what becomes our new norm, I think that should become the new norm in general, because why are you not allowed to vet a person and see if you're a good fit for that person from a distance, which is safer than having to meet up with that person in a bar? Even though these places are opening and you guys, as early as this weekend might have an opportunity to go out, you still want to make sure that you're doing what you can to protect yourself, and you're doing what you can to remain safe. I think that sometimes we take for granted our health and our safety and our wellness when we're thinking about dating. And when I tell couples, date your partner, get to know your partner, because when you're married, even though you think that you know your intimate partner, you think you know your spouse, you really don't. Like you said, people are a part of an evolutionary cycle of life. So you should be, we should be growing at every stage and phase of life. And as we evolve, we need to be allowing our intimate partners an opportunity to revet, to get to know us, to get to know those evolved parts of us, and make ourselves vulnerable enough to share with them in a way that allows the transparency to become something that is a sort of a new norm in our relationship. And so we learn how to connect with them on a different plane. So I think sometimes you have to make dinner, right? Light some candles, sit down, like you said, and start using the app, getting to know the person that you're with. Sometimes you got to step out on faith and go to that park, hold hands, and ask questions and find out what their viewpoints are and their perspectives on various items, so that you can find out who this person is transitioning to. How can I better be of support to you, right? And the most important thing is, I talked about the transition that grief has taken since COVID-19 started a little bit ago, when I talked about losing my cousin. And, it's what's really, really sad is that for us as a family, my family, we don't get together often. So families typically that live abroad, you don't see your family members that often. And to me, I thought to myself, like, this is a baby. He's a baby, he's as young as my kids. Like, when you have a cousin that has a baby and you're close to that person, you don't even know, you can't even fathom what it's like, right? And I'm a psychotherapist. I'm treating people every day for depression and people who are survivors of suicide attempts and things like that. But when you personally have to experience it, it takes a quite of a different toll on you. And I had to take a step back. I had to take a self-care day. So when I talk about how you deal with depression and how you deal with grief now, I want to talk to you guys about some of the things that personally have worked for me, but also things that work for my patient base. you have to take at least 2 days to just sit with the reality, especially now, knowing that you can't have a regular service, knowing that you can't have a regular burial, knowing that you can't do the things that you normally do. You can't reach out, touch, agree, and pray or do whatever it is that you do to bring solace to your family members and yourself. You can't do those things in the same ways you used to. And so you literally have got to get in a place of acceptance that this is the new norm for us. This is the safest way that we can grieve together and learn how to support each other, one another from a distance. That means giving yourself adequate times during the day, throughout the day, to grieve in cycles, because grief does come in waves. And so when you feel sad, allow yourself time to feel sad. If you want to cry, allow yourself to cry. Crying is a form of a catharsis. If you're a person who exercises a lot, get in touch with that part of you. If you're a nature watcher, get out there in nature and still socially distance and allow yourself to be out in nature and connect with the earth in a different way that allows you to see that this transition and death was a part of the cycle of life. And help the other members of your family by checking in on them. I think that we have to be, like I talked about, accountability for the vast majority of this particular live, but we have to hold ourselves not only accountable but responsible for our mental health and wellness and our emotional health and wellness, but also for that of those people that are family members or connected friends of ours, and simply be a beacon of hope and a beacon of light for one another in a way that is transformative to our growth and our resilience during this time, because that will continue to build, you know? So that speaks to accountability, which we're going to talk about accountability. That was the next topic. So now I want to say, we're going to talk about how has COVID-19 affected your personal / professional circles. Marcus, do you want to talk about it or you want me to start off?
I could talk about it. I mean, for me personally, I want to say, I seen a quote yesterday was said, if you're not taking advantage of all the free certifications or taking advantage of the career opportunities that this time is presented, you're pure lazy. And for a second, I thought about myself. So I was like, dang, I am, sometimes you can feel like you're doing a lot, but you don't feel like you've done enough. But I always said to myself, like, I want to feel like I'm pushing myself to the hardest extent I can push myself and
Right.
taking advantage of every available opportunity there is out there. I've seen that Harvard is doing free certifications for different things. These are free certifications that usually cost up to $2,000 to get, that
And so,
looks really well on your resume. And I also thought about, for me professionally, even Dr. Jefferson, meeting you through this, getting ready to speak on the platform later this week with you, getting ready to do the things that I enjoy, but also being able to help the community, professionally and developing my skills. I love to be an advocate for the community, and never in my dreams that I think starting Unplugged Health and building my podcast would connect me with amazing people in a major way in the community, to bring about something new and bring about education in the community and touch those untouched populations. So I've been grateful, professional and personally, self-reflection. I've never been able to wake up in the morning, do my work outside of, working remotely and going into the office a couple days out the week. I've never been able to take that time to actually just sit on my porch and watch the wind, or just sit out there and take in a couple deep breaths of air, because I'm so focused in going to school, working, podcasting, that sometimes I didn't realize that you need to sit down and self-reflect. So personally, I'm growing. I'm steadily growing and figuring out how to stretch myself beyond my wildest dreams, how to maneuver and anticipate the next move that's going to happen professionally and personally. What do I want to see come out of this? How can I reconnect and be a better Marcus after this COVID-19? What do I want to tell people in the next generation, about this experience? What can I speak on about this experience? And I think as I steadily grow and reconnect myself, I kind of tell people around me too, be an advocate. I don't just always say, I do it just for the podcast, but I always just tell people personally and, in my professional and personal circles, be the best you can be. Don't never feel like, time is wasted. Always find new opportunities professionally and personally. Look around you, try to see where can I stretch beyond my measure? Who can I connect with, or where can I navigate myself, to become or be in a better space?
Right. Don't limit yourself.
Yes.
And so I think that oftentimes we limit ourselves because we're afraid to step into that new space. And most people are. But I think that to eliminate the anxiety and the fear around, you being able to navigate new domains, I think sometimes you have to do some positive self-talk. And for those of you who are watching on Facebook Live and YouTube Live, share with me some of your thoughts, like some of the things that you feel have affected your personal life and your professional lives as a result of COVID-19, because I think that everybody is experiencing a tremendous growth. But I will also speak to the same comment status that you talked about. So there are a lot of people who saw that, and I at first I talked about clinicians, right? Therapists, a lot of therapists who were displaying clinical symptoms of anxiety. I'm like, you guys should know better, right? We're all therapists. You should know what anxiety looks like. You should know some effective, means and practices, best practices for eliminating and at least trying to mitigate some of the anxiety that presents around trauma, because this is a traumatic event for people, whether they know it or not. And so the thing is, you have to recognize that this is a thing that's happening to you. And so if you find that you are not benefiting from, like you said, you noticed that you weren't necessarily applying yourself to its full capacity. If you find that you're a person who's sitting at home and you're not taking advantage of some of these things that you typically would jump on, it's free education. It's a whole class. What are you talking about? If you find that you're going through these things, what are some of the best practices for you to be able to capitalize on and now live your best life, get in a place of acceptance and apply yourself in a different way? It's really simple. Acknowledge the fact that currently you're in a place where you feel like you're limited, you feel like you're stuck. And once you see that, you know what it is, and you can move it to the side and you can step into a new space and live your best life. You can start applying some coping strategies that are effective and help you. I think that sometimes we don't give ourselves credit for the resiliency that we house inside of us. And that's still something that's building actively for a lot of people. And I think that as it continues to build and as we continue to accept who we are and who we've become as a result of COVID-19, we will be more thankful for the opportunities that we've finally been able to take advantage of, finally been able to see for what it is. Even if it's just taking a moment and actually spending time with your family. Even if it's just taking a moment and realizing that you're human and you need a moment of space to cry, a moment of space to breathe, to take a break. Even if you've learned that your best friend really isn't your best friend. Even if you've learned that the people in your professional circles are all snakes. These are things that may appear to be very negative, but I think they have the benefit of being very positive outcomes or very positive lessons for you to apply to your life and move in a different way post COVID-19. And so I think that's the space that we have to find ourselves in for us to say, okay, here, now I'm reclaiming my time and this is how I'm going to do it. Many people have learned about financial management. You see a lot of skills that people have acquired because, like somebody said earlier, you do need multiple streams of income. And I think if people didn't know it before now they do. I'm a woman who wears many hats, and that's the reason I wear many hats, because I understand the importance of having multiple streams of income, but not only that, of being an independent proprietor of life. And so I have a lot of kids who depend on me My family depends on me to support them. And ultimately, I never want to be the person who lets them down. And so if I've learned anything, it's just simply, let me take better care of myself so that I can guarantee that I'll never let them down, because I'll be here for that. If that means that I have to be away from them for a little while longer, and these are uncertain circumstances and things like that, I need to figure this out for them to be better, then yeah. Have I learned new lessons as far as like their school lessons and things like that? Because of course, I'm a resource guru. I got to teach them something. I've learned some new things about the way that they do math. I've learned some new things about the way that they learn. I've learned a lot of things about my kids as they have changed as well during COVID-19. And I love that this has allowed me the space to fully transition everything in the way that I was already a telehealth provider for telemental health for years now. So that wasn't new to me. So that wasn't an adjustment, but I do like the fact that now I've been also allowed the privilege in the latter weeks to work from home and manage charts and things of patients that may be at the hospital and things like that. And so that's allowed me even more space to be at home with them a little bit more, just so I could observe a little better what they're up to. I've been a really nosy parent. Those are my parenting tips too, because I talked about that. I think I've pretty much covered everything for the most part. Is there anything else that you would like to add?
No, we covered a lot of different topics, and I just wanted to leave you, with the message of saying I learned something yesterday. Well, the previous Sunday, I was sitting and listening to a message from this church. I don't know, so many churches stream online. I just be clicking and listening. But the message was like, at every stage of growth, you're gonna lose something. And that just stuck to me, because I felt like at every stage we're growing, whether it be for something positive or whether it be something we're growing out negative. We're growing, we're reshaping our lives every day, every hour, every minute that we have breath in our body. We're growing. We're learning learned behaviors, or we're detaching ourselves from negative behaviors, negative things that attribute negative things to our lives. So that kind of stuck with me. So like during these times, I said to myself, I wanted it to be a time of growth. And I know that everybody feels like they're losing someone, which my condolences goes out to them if they've lost a family member or a loved one. But my condolences goes off to people who feel like they're losing their self during this time also. And, I want people to understand that, like, this is not the time to lose yourself. This is not the time to fall short of the stick. There is the light at the end of the tunnel. We are growing. We may have lost things, but we have to see that the growth we're going to come out of this economy is going to come back stronger than ever. I believe that people are going to come back stronger than ever. Healthcare systems are going to come back stronger than ever. We're going to be able to be well prepared for the things that are here to come in the near future. It took us to go through this and continue to go through this, but at every stage we're growing. At every stage we're going to lose something or someone, but in the end we're losing it for a bigger purpose, and in the end we're going to see that bigger purpose, and we're going to be able to attribute what we went through to get to those stages. So like, I just want to keep telling everybody, keep being an advocate for your health, mentally and physically. Keep pushing through and don't fall short of the stick. Pick up this stick, find your resilience, find what makes you happy, use this time to recreate and rebuild yourself, or even build upon if you feel like you know yourself already. Take this time to move forward, keep pushing. And like, I want people to also to know, like, you might not be the fastest runner in the race, it's not always the fastest person that wins the race. Sometimes slow and steady. Sometimes taking the time out to restructure yourself, sometimes to think about the next step, sometimes to think about the processes and the procedures, the assessments. You know, sometimes doing those steps, you're able to navigate through with no issues because sometimes you're not just rushing. So take this time and remember, slow and steady. This, you know, it's not always the fastest that wins the race. Take the time to get to know yourself. Take the time to reconnect with those people around you. Build your clientele, build your networking, build your business, build your credit, build your finances, build your way of thinking, build your culture, build your sensitivity to different things. You know, be able to say, I came out of this on a better end of the stick. I wasn't the fastest in the race. I didn't have the most money in the race. I wasn't the smartest during the race, but I was able to get to the end of the race and be on the other side to look back and look at the things I accomplished throughout the race.
And let's talk about the way you conceptualize that. Oftentimes, when you're not the strongest, the fastest, the most wealthiest when it comes to finances, you don't give yourself confidence and you don't give yourself encouragement, acknowledgement, or approval to run those races in the beginning because you're not giving yourself credit for being you. Sometimes you have to simply be true to yourself and be true to the evolutionary cycle of growth in life because that's what life is. In order for you to run those races, in order for you to do the things that you've never done before, to accomplish the things that you've never accomplished before, because you have to give yourself credit for experiences. Experiences and exposures in life are meant to teach you something. And if you're not taking those experiences and those exposures and learning valuable lessons to apply to your future mechanisms and life exposures, you're doing yourself an injustice. And so I invite people and I challenge people today to kind of become the type of people that not only advocate for self, advocate for community, advocate for health, advocate for wealth of knowledge and what do we say, emotional wellness, right? So
Yes.
that you can remain balanced and stable in order for you to contribute to yourself and recognize the things in yourself that needs to continue to build upon in order for you to become the best version of yourself that you can be, because you're not done yet. And if you want to finish, you've got to be able to see clearly. Sometimes you put yourself in a place to where you can't see clearly and you think that you're buried, but you don't realize that you're not buried. You're not buried under the stress and the duress of depression, anxiety, PTSD, all of these things that happen, but you are planted so that you can grow out of that space into something greater. And so what I tell people is that you have to acknowledge the areas of your life that need continuous growth if you want to apply the principles of your life wisely, because then you'll know where to put this lesson that you learned from that experience, this lesson that you learned from that experience. Oh, I heard this piece of information from here. How can I help another person grow in the space that I'm observing that they need growth in? And you know that you have the information, right? You can't die with it. You got to learn how to spread that wealth of information and not expect something in return. Um, I didn't really speak about the way COVID-19 really affected my professional circles, but it did make me see people for the type of people that they are in mental health practices. I encourage people to start selecting a practitioner if they're going to a mental health provider that is passionate about what they do because they love outcomes for people and not necessarily because they need a job. And that piece is everything. That's what I've learned. I've learned that there are some clinicians that are not, we're not all created the same. And it's a disheartening discovery for me. But at the end of the day, you know, when you know better, you do better. And I've had to give myself credit for that because I want somebody that is as passionate about people as I am, rendering services to people, especially in the sight of this type of a crisis, so that people can get to a better place of functioning, so that people can get to living their best life, so they can have the coaching, so they can have the therapy that they need to heal and reveal the layers of them that speak to their greatness. And that's how we have to operate as individuals as well. So that's all that I have, you guys. Um, I guess I'll catch you guys on our next COVID discussions. I think the global discussions, that global meeting, I think that's going to take place before the next COVID discussion next week. I'm not sure. I got to check the schedule, but just make sure that you guys like and follow this page if you're not already subscribed. And for those of you who are following on Facebook, do the same. Make sure you share this content because I'm sure it's a wealth of knowledge. We discussed a lot of stuff in this one. But share the information, and we appreciate the feedback from you guys today. So let me see how I end this stream on my Zoom first.